Hey everyone, it's Chris from NoteKnight. Today I wanted to share my ICU brain sheet that I developed over the past several years working in critical care. I've used this in step down, I've used it in level 1 trauma ICUs, um, and I've given it out to new grad nurses, nurses that are transitioning from med surg to critical care, and nursing students that are passing through the unit, just as a good way to demonstrate how somebody that works in critical care, the information that they like to keep track of for their patient, so that they have a big snapshot of what's happening with them and managing their care throughout the day. And I'm going to make this freely available via a link to the Google Slide documentation. You can modify the sheet however you would like. You can download it, you can share it, or you can just watch the video and get an idea of how I do things and then use it to build your own. Some people like to just use blank pieces of paper and fill them in every morning, and that's perfectly fine. I find it really easy to keep this sheet in my binder, and I use a highlighter and I write copy on it because it doesn't show up when you run it through the copier. Um, and I just make 15 or 20 of these at the start of every week or two. And stuff them in my binder. And then next time I'm getting a patient, I just slip it right out and I'm ready to go. So without further ado, we'll jump right in. To the far left, we have our patient information at the very top corner. It says providers and consults. So if they have anybody following them, infectious disease, pulmonology, cardiology, and who's the primary team on them. You might have a list of residents along with an attending. So plenty of space in there to fill in who you need to be talking to or looking out for throughout the day. In the middle at the top, we have the room number, code status, their date of birth, their admission date, their diagnosis, isolation precautions, restrictions that they might have, fluid restrictions, their height and weight, last time they had a bowel movement, GU, how are they voiding? Are they using a urinal? Do they have some type of wicking device? Do they have a Foley catheter? And I usually like to pencil in above or below that during report, how much did they go the last shift? Was it 400 milliliters out overnight or what? Because the doctors will ask that, and other um, providers coming through will want to know this information. So it's good to have a working memory of what happened in the last shift as well. Their diet that they're on, are they eating regular food? Are they on a pureed diet? Are they on a cardiac diet? Do they have to modify how they swallow pills? Do they only put the pills crushed into a puree for them to swallow it safely? Are they on tube feedings? Do the tube feedings have a rate and a flush? Are those things at goal? Do they need to be titrated in the next several hours and increase to try to achieve the nutrition's goal for them? And so you can write above and below in those little sections those extra details and squeeze them in there. And their activity level. Do they get up by themselves? Do they use a walker? Are they a 2 assist, max assist? Do they need an inflator to be moved around in the bed? Any information like that. To the right of that, big open sections, their patient history. People have long histories. They've been in and out of the hospital. So you can feel free to fill in all their information right there. And then above that, a little section for you to add allergies. Now, people can have a long laundry list of allergies, but sometimes I like to just write the heavy hitters in there, the antibiotics and or, pain medications that they might be allergic to that a doctor could easily, put in, and you would say, hang on a second, I remember that, it's on my brain. All right, switching back all the way over to the far left, we have the section for laboratory data. These are your fish bone diagrams. The top ones are not labeled. But though that is for CBC and BMP below that. If you're not familiar with them, you can do a quick Google search on it and you'll be able to see what goes where. But once you start using those, it makes it really easy to track all that data that's in the flow sheets and have the pertinent information from it on your sheet here. So the CBC is going to have your WBC, hemoglobin, hematocrit, and platelets. The BMP, you're going to be able to track stuff like your sodium, your potassium, the patient's kidney function and their glucose. If you did not know, glucose is a vital sign. I actually learned that information not too long ago. It seemed silly to me that I did not know that, but it is included in vital signs. Um, Below that, we have a section for your ABG, your blood gas information. You can see your patient's pH, CO2 levels, O2, and bicarb. And then below that, some critical electrolytes, calcium, magnesium, phosphorus, and their coags, their PT and INR that track, how long is it going to take for this patient to clot, so their risk for bleeding. Below that, we have some, stuff that shows up pretty commonly in emergency department and critical care labs. So I just made little sections for it because they come up quite often. The patient's lactic level, their D-dimer procal, BNP, and troponins. And in troponins, we have, some space below that for you to put either any pertinent or outlying lab that might be, something you want to write down about your patient, but also the troponins tend to be trended over time for patients. So, every few hours, the doctors are going to check to see if that number is going up or down. Is it getting better or worse? And you can kind of, keep track of that in that little section. Straight down, we have lines, drains, and airways. This is pretty self-explanatory. This is where your IVs are going to be. This is where your surgically inserted devices are going to be. So if the patient has a chest tube, a JP drain, or anything like that, you have plenty of room to write down where it is, what it is, when it was inserted, and how much may have come out over the previous shift, so that when the doctor's around it and asking you questions, you can go, oh yeah, he put out 50 milliliters from his JP drain overnight. And the surgeons want to know that information. So it's good to keep track of it. All right, so straight below we have airway. This is your advanced airway to start on the far left. This is going to be your endotracheal tube size, location. Is it measured at the teeth or the gum? How is respiratory keeping track of that? And where was it last inserted? So you need to make sure when you do your assessment that it's in the same place. It hasn't moved. If the patient didn't shake their head and dislodge their tube a little bit, and it needs to be advanced. What was the ventilator mode on? What was the rate, the FiO2 percentage, the PEEP, the tidal volumes, and what are their peak inspiratory pressures currently? I like to write all this down first thing in the morning so that, if anything happens or changes throughout the day, I have a baseline of where my patient was at. You might have the RT come by and see that the blood gas from the morning was a little bit off. They're still in a respiratory acidosis, their CO2 levels high, and they're going to go in there and they're going to increase the respiratory rate. And you can easily just kind of mark that section out and update. We went from uh, 20 breaths per minute up to 25 to try to blow off some of that CO2 and balance them back out. To the right of that, we have our kind of less advanced respiratory support here are just BiPAP, high flow nasal cannula, and a regular cannula. You can just write down your flow rates right here. Are they on 40 liters, 100%? What are the BiPAP settings? 6 liters nasal cannula, and any other pertinent information like we added humidification, anything you can use in that little section below as you would like. The work list in this section, I like to use it for if a patient has something I need to ask the doctor about, a critical lab value I need to report, something that I just got the information for and I need to follow up on. I don't want to forget. I put it front and center for myself in the little work list. And that's for me. And then I will just cross them off as the day goes on, knowing that I got them done. PRNs, pretty self-explanatory. Do they have any pain medications or frequent, cough medicine, anything like that that you're giving patients? You can write them down there, and you can write down when was it last given, and keep track of that. And then right below it, we have orders. So, are there any MRIs, CT scans, routine imaging that's getting postponed for one reason or another? The patient's too critical, or those services just aren't available on the weekend. And then when you give your handoff report, you can say, hey, they've got an MRI due tomorrow. Below that, we have a section for assessment, intake and output, and restraint documentation. This is documentation stuff that previous hospitals that I worked at did not have. a means to keep track of it for me. So I had to make sure that I had gotten it done. So they were just check boxes for me, and I would circle off or scratch off, that I had done 7, 9, 11, 1, 3, and 5 o'clock restraint documentation, stuff like that. But nowadays, I'm working at a hospital. It has much more advanced computer system, and I don't really have to worry about that. But I left them in because they're kind of core to your nursing, things that you have to do throughout the day. To the right of that, we have patient's name, age, and sex. If your unit has like a sticker or a patient label or something like that, you can easily paste it over this little section. Above that, I like to keep 72-hour image documentation here. So if there was an MRI done, a head CT, or anything critical to the patient's current care, chest CT, and they found something, I can document the size of what they found, or the radiologist summarization of the image, and keep that there. And it's really helpful when patient family members show up and or doctors show up and you start discussing the plan of care. You can retrieve some of those image results, which people really like to know about. How was my patient's image? All right. In the handoff section, it's not really labeled, kind of how I use it, but because it's kind of top to bottom, I just over time started filling it out chronologically. So at the very top during report, they usually start off like what brought the patient in, and I will jot in like they were experiencing nausea, vomiting, and they had abdominal pain, and or shortness of breath, and I'll fill that in at the top. What was their primary, concern on admission? And then in the middle, I will write down, how they're doing right now. Are they alert and oriented? Are their vitals within normal limits? Are they trying to crawl out of the bed nonstop? That's what I kind of put in the middle section. And then below that, I kind of extended it not too long ago. And that's why the boxes kind of overlap in this one little particular region. But what I like to put there is infectious disease information. So, they came in with all these things. This is how they were presenting. Here's how they are right now. And then we drew blood cultures. We did a urinalysis, or a urine drug screen. And, here's the results of those tests. I kind of fill in that section. I don't know why, but that's what I personally use it for. Feel free to use it just as extra space for yourself. And then to the immediate right, we have our body diagrams, self-explanatory there. It's for your skin information. It makes it easy for you to put a little X over a section, circle, draw an arrow, skin tears here, skin tear there, bruises, contusions, incisions, drain placements, anything you want. And if there's nothing going on in the center, I usually just write skin intact. To the middle, biggest section you got, it's for your meds and continuous fluids. At the hospital I first started at, they didn't have a great way to keep track of the meds like in the computers. So I'd have to write them all down by hand and then go pull them from the Pyxis. And I needed to keep track of who was getting what and when. So I wrote down all my meds, but over time the computer's gotten a little better. I don't really have to use it for that, but it has saved me when I got floated to other locations like an ER in a different hospital, and they didn't have the patients programmed into the Pyxis. So you would have to know the drug so that you could pull exactly what they needed from it. So it saved me later on, and I just leave it where it is right now. And then the continuous fluids, are they on a protonic strip? Do they have sedation running like narcotics? Do they have a patient controlled pain pump, and what are its lockout settings? You have plenty of room to write down those details in there. And that's pretty much all the sections. And there's plenty of space to utilize as you would like. There's a little extra white space here and there, and you can start filling it in how you prefer. Again, this is freely available, so you can share it, change it, do whatever you would like with it. But hopefully it gives you a good jumping off point if you're new to this kind of thing. If you're experienced and you're just tired of having to write these things out manually, maybe it just makes your mornings a little bit easier when you're coming into work. You just make a copy of something really quickly. But I hope everybody enjoys it. You can find the link in the comment section below and or directly on the blog post. And hope everybody has a great day and good luck out there.